This is Core Conversations with Natalie Baggio.
Welcome back to Core Conversations. Today's episode is an important topic that we're here to discuss. And today my guest is Dr. Max Schaefer. Welcome to the podcast.
Thanks for having me on, Natalie.
Yeah, I'm glad that you're here today, and I'm looking forward to you being able to share the great work that you're doing across Southwest Michigan and share with our communities the impact that substance recovery clinics are offering and how you're breaking down some of the challenges or the stigmas within our community. But before we start with the topic, I would really enjoy you sharing some of your personal journey and how long you've been living in Southwest Michigan.
Sure. I actually grew up in Kalamazoo, and then I did my undergrad down in South Bend. So this part of the country is very familiar. For training, I was in Indianapolis and then out on the East Coast in Maine. But we ended up coming back home about 4 years ago now, and when I joined Corewell here.
That's great. And you live in Niles?
I live down in Buchanan, actually.
Buchanan,
Yep.
Okay.
Yeah.
And your clinic that you practice is in Niles?
Yep, kind of split between two clinics down there, the residency clinic at Longmeadow, and then down at the substance use treatment and education clinic, and that's right across from the hospital in Niles.
Well, great. Yeah. And about how many patients a year do you serve?
I don't know if I have an exact number on that. I will say it is steadily growing, and I know in the substance use clinic, we have well over 300 patients seen just since opening last year. It just continues to grow.
Yeah. Well, we appreciate you being here and helping lead in this passion project of yours and something that we really need in our community. Would you share with our listeners about our substance use clinics, and maybe even after, it might even be good if you share a patient story, if you'd be open to doing that.
Sure. I think one thing I want to highlight is that I think people may have an idea of who comes to our clinic. And I just want to highlight, it's people from all walks of life. We have teenagers in high school in our clinic. We have college kids who maybe just have some questions about how to be safe in college, questions about certain substances, about alcohol use, what's a safe amount. Maybe they feel like things are getting a little out of control. And then probably more classically, what people think about are people who inject drugs or, often the hospital, a common admission, maybe alcohol withdrawal syndrome or an overdose. So really, we see a very broad spectrum of patients.
I think education piece is really important, what you said, because sometimes people don't know what is normal or what's not normal, and I think that offers a lot of opportunity for people just to walk through the door and be able to ask those questions. Exactly.
I think, one thing you'll find when you walk in the door is a friendly, team-based approach. We really take pride in the fact that, quality addiction care is really team-based care. And so it starts right at our front desk. Brittany down in Niles has been with me since we started at the family medicine clinic. And, Diana, our MA, is when, we allow her to have vacation a couple times a year. And when she does, our patients, I think they're more upset than when I'm gone even. It really is, we worked well together to support our patients. And So creating that easy access and that front door. Yeah. Is there a story where someone walked in or you had someone for education where it turned into where you've been able to help navigate someone through the system to a better outcome? Yeah, I think one really good story actually was a primary care patient of mine. Started as a primary care patient of mine and had a diagnosis of oral cancer. Went to University of Michigan, had the cancer treated, but was having a lot of struggles with depression and other challenges that you would expect with recovering from a major surgery and a cancer diagnosis.
Right.
Had always drank regularly, and that really accelerated after that diagnosis. This person ended up working with our team to go through hospital admission for withdrawal, subsequently went through residential treatment at Sacred Heart, and then followed very closely with us as an outpatient after that. Just heard, I think he's at 15 months in recovery. A lot of the side effects from swallowing, all the mood things, those things have essentially gone away despite his big surgeries once he stopped using alcohol. His daughters reached out to us because they couldn't believe how much better he was doing socially, emotionally. And, I think sometimes things that, maybe someone's always had a couple drinks at night, that can change with life events. And, I think treating the alcohol or the substance use disorder for this patient had probably a bigger impact on his quality of life than really any other intervention we could have done for him.
Yeah. Well, that's a great story. Thanks for sharing that. And I think it just highlights that sometimes life can take us down different paths that we don't expect. And having your services and your team services to help our community navigate those challenging situations has positive impact in our community. So thank you for the work that you're doing. How did this inspire you to start this work, and what type of resources and teams did you need to be able to move this forward?
Yeah, that's a great question. I think I don't think I actually answered your initial question of why I went into this, and it's sort of tied to this. When I first started medical school, I didn't think that I would be doing a large part of my practice in addiction medicine. I had friends and family who were impacted by it. I think most Americans, if you look around, do.
Yeah.
And it was really in medical school. I was on these rural rotations in rural Indiana, and I had two particular attending physicians who made a big impact. One was in recovery, and they were very open about it. This was a rural family doc who did everything, delivered babies, worked in the hospital. And I was kind of struck by how open they were about their recovery, their journey. They went to meetings daily on top of everything they were doing. And they just told me this is really important and people can get better. And that stuck with me as a student. I had another rural medicine attending who was very great doc, very conservative guy, probably one of the last people I think I would have expected to be providing a lot of addiction care. And that was frankly bias on my end as or stigma probably as a medical student. But he pulled me aside and he said, hey, you'll see that I do a lot of addiction care in my practice. I don't advertise it. But, I grew up in this community and I grew up with a lot of the people I take care of. I coached some of these people in football when they were growing up. And you can't just turn your back on somebody if you don't agree with the decisions they're making. And these medicines work well. People get better. And so those two preceptors really impacted me. When I went to residency at Maine Dartmouth, they told us day one, addiction is a chronic treatable medical condition. We're going to teach you how to treat it. And that was just the attitude. So I kind of was trained to think this is just what we do. When I moved back to the area here, I quickly found hey, there's a lack of resources. There were some resources in our community, but it seemed disjointed and disconnected. And so I kind of spoke with my partners at the residency and our residents, and I said, this is a need in the community. can we try and meet that? And to credit to all of our residents and my partners over there, we just sort of figured it out. And we started as a small clinic in the back of our family medicine office. And once we started taking care of people, it exploded. And we had eventually more patients than we could take care of out of that clinic.
Well, that's great. I mean, statistically, across Southwest Michigan, this type of service is definitely needed, especially around education and treatment. But I'm glad to hear that the residency's been a good support as we think about workforce and stabilization of healthcare providers here in Southwest Michigan. The residency is a huge part of that future of how we'll continue to be able to provide care here.
Yeah. Yeah, I think that, the residents also, they have a really unique perspective. They're in the ER, they're in the hospital, they're in the outpatient clinics, they rotate in the specialty clinics. They probably see the big picture better than anybody here.
And now you learned that leaning in early on in your education can definitely shape the way you think about providing care in the future.
Absolutely.
Yeah.
And so, my hope is that if I catch them while they're young, they'll carry this forward and continue to take good care of people.
Yeah. So doing this important work, do you utilize community partners? Is there like a consortium of people who are working to provide education and treatment?
Yeah, that's a great question. And I think it's a good opportunity to call out a lot of great work that's happening in the background. Our community doesn't see, a lot of the collaboration behind the scenes. So one or group of people I'll mention is, it's called ROSC, Recovery Oriented Systems of Care. These are different players throughout Berrien County, law enforcement, different treatment clinics, specialty courts, and we meet once a month and discuss, new ideas or challenges in the community, and we work together to try and meet needs, public health, better treatment goals. That's honestly one of my favorite parts about growing this is working with other community partners, trying to bridge that gap and smooth transitions of care.
Right, because we can't do this alone.
No, I think you're exactly right. And, Corewell, we're the primary healthcare provider in Berrien County. Right. We operate both hospitals, all 3 emergency departments. We have to be a leader in this. But my goal is patients get treatment where it's best for them. And if that's at Intercare, Harbortown, Niles, or Cass Family Clinic, then let's help facilitate that. They take great care of people too.
Absolutely. And considering that we still have a shortage of healthcare across Southwest Michigan, it really takes our partners to ensure that we're able to provide the right access to care.
Absolutely.
If someone, by listening to this podcast with you, sharing this information, what is one way people could get in contact with you and your partners to learn more?
Yeah, I think, you can walk in. Prefer a call if possible, but we'll take walk-ins.
Okay.
Dr. Moreno right now is at the Center for Better Health in Benton Harbor, providing addiction care on Wednesdays and Thursdays. And then in Niles, we're open Monday through Friday, with goals to expand those hours over time. But, call either clinic. If you even just have questions, if you're not sure you're ready for treatment, that's okay. We're a low barrier clinic. We'll meet you where you're at. And if we're not the right choice, we'll help connect you with someone who is.
Yeah, well, thank you very much for your time today. And this has been very informative. And I hope that this information helps others think about reaching out for help if them or a loved one, because it's really important that we try to create a better and healthier communities here in Southwest Michigan.
Great. Thanks so much, Natalie.
Thank you for joining us on Core Conversations. We'll see you next week.